Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sharrie Harlin, program host for Let's Talk Together, and thanks for joining us today. Today, my guest is Casey Krogman, and she is with the Reid she's our Cancer Center Navigator. Welcome, Casey.
Hi, thank you. Yes, I am the Navigator for breast cancer patients in the Breast Center at Reid.
Okay, and well, before we get started, tell us how your background and how you came to Reid.
Yeah, I've actually been with Reid for 10 years now. I started in 2014 after graduating from Indiana University East. I started working on the inpatient unit, but was involved with oncology as well. I then transitioned to outpatient oncology, where I have been since then. So a total of 10 years of experience in oncology. I then kind of developed my passion, learned more about different patient care and different options within Reid as far as services go, which kind of pushed me to pursue my master's degree in nursing, which I also finished through Indiana University East. I then transitioned to my current role as the nurse navigator for breast cancer patients here.
And I just when I sat down to talk with you, was just saying what an important position the nurse navigator is. And you get the highs and the lows.
Yes.
One of the things when I get my mammogram, you just almost wait. They can say, you're free to go. And get out my that warm pink robe and dash back into your clothes. But also, in case there is something wrong, then people need to sit down and have a very calming person to talk to them on next steps. So you're that person.
Yes, thank you. Yes. So I am able to meet with women the same day of any type of abnormal imaging and kind of get them set up for the next steps, be it referrals or further imaging that was already taken care of or that needs set up.
So it's very, very important. We're so happy that you're part of the team.
Thank you so much.
October is Breast Cancer Awareness Month. Can you talk a little about the significance of this month?
Yeah, so Breast Cancer Awareness Month was actually started in October of 1985. It was an initiative created by the American Cancer Society as well as a pharmaceutical company. Basically, they started this to kind of promote the importance of mammograms, spread awareness about breast cancer, and also raise funds for breast cancer. Former First Lady and another breast cancer survivor, Betty Ford, actually had a hand in helping this initiative get started as well. And to this day, we still here at Reid and many other organizations use October as a month to spread awareness, raise funds, promote mammograms, and just kind of provide education to the community about things.
It seems that one of the first things that it seemed that the breast cancer awareness really started other cancer awarenesses as well. That they did such a good job with people know about learning about October and making sure that have you scheduled your mammogram. Is it around that time? I know mine's usually December. So right before you go out before break, I normally schedule mine right during that. So
Yeah,
it's interesting that it's always easier if you pick a time and stick with that.
Yep, I agree. We see a lot of women come through every year on or around their birthday, or they know their month and they say, well, I'll be back next March or next April. So they definitely get that incorporated into their routine, which is great to help them remember to get their mammogram every year.
And you were saying because if you do it every time during that particular time, then it's a lot harder to forget.
Yes, absolutely.
What are some of the, and share some statistics about the prevalence of breast cancer?
Unfortunately, it is a very common cancer. In America, besides for skin cancer, it is the most common cancer that women will get. And the overall risk for the general population, as far as women go in America, is 13%, meaning that 1 in 8 women will develop breast cancer at some point in their lifetime. That statistic has increased as far as incidence goes. We've seen improved statistics elsewhere, but the incidence has increased. And I think it's important to remember that just with over 200 to 300,000 women per year in America being diagnosed with breast cancer, also around 2,800 men being diagnosed every year with breast cancer, which a lot of times people don't think about, especially men developing breast cancer or addressing any concerns that they might have as far as chest pain or a lump that they're feeling or any other types of changes in their health.
On that, when you mentioned like with men that receive it, is there a glaring figure or something that they would notice that maybe might be different for in men versus women finding out with breast cancer?
Not specifically, and men are also a lot less likely to be taught or to proceed with monthly self-breast exams like women are educated on. They might not address any nipple changes or drainage or just overall changes to their chest area that they might not think that they could be at a risk of breast cancer, and they might not think about needing it to bring it to their provider's attention.
So often, maybe do they find out later because of that, not knowing the signs?
I think that very well could be the case. Mm-hmm.
It says 85% of diagnoses occur in women with no family history. Can you share more about that?
Yes, that statistic is true. Women with family history, of course, are at an elevated risk for breast cancer, but that information as far as not having a background or a family history of breast cancer can kind of create a false sense of security for some women. Maybe they don't think it's as important to proceed with yearly mammograms or start when they should, just based on not having a family history. I see many women coming through with the first abnormal imaging and they exclaim, well, I don't have any family history, so I'm sure it will be fine. But unfortunately, that's a very real statistic that it is much more common to find breast cancer in women that don't have a family history.
And on the other hand, do you have cases where there is a big family history?
Absolutely. We see that as well. And a lot of times those women already know about their family history. They already are keeping things in mind, and they'll reference that in their care in our conversations. They'll talk about what they have seen their mother go through, their grandmother go through. They'll talk about the different family members on both sides of their families that have went through breast cancer or other types of cancer. And so they seem to be a little bit more knowledgeable at that time, just because of the unfortunate personal history that they are aware of it and have seen it firsthand. And so sometimes that is a positive thing as far as getting them in sooner. They know when they see changes to their breast health and when they find anything new, different, abnormal at all in their health, to bring it up to their provider's attention, because they know with the family history that they need to be extra cautious.
And I know I have 2 sisters, and they both right now are dealing with breast cancer. And so they're really, when it came time last December, they were, make sure you're there. I'm like, I'm there, but that, but also in their on their one of their relatives' side, that almost every person has had breast cancer. So, like my youngest sister actually had a marker since she was 17, so
Wow.
to be prepared.
Okay.
So.
I'm sorry to hear that about your family as well. That's a lot on anyone, especially multiple family members. But I'm glad they're stressing the importance to you and probably everyone else.
Right, they're very
continuing.
adamant about making sure that people are up to date with their mammograms and the challenges that they've had. So.
That's good.
Truly.
And unfortunately, they have that platform just
Yes.
with their personal history. So I love to see when women use that as a positive thing as far as spreading awareness, especially with their family.
Definitely. And also, is there more? I know I've seen in some cases that depending on the age of the diagnosis, the person that was diagnosed, have you seen with younger people being diagnosed, or has age, does that affect?
Yes, yes. On both ends of the spectrum, actually, because the overall risk can increase and typically does increase in older women, starting as young as 65, as far as an elevated risk beyond family history and other kind of lifestyle or personal health history. But yes, we are unfortunately also seeing an increase in women being diagnosed at a much younger age, coming in for their first mammogram or even sometimes before their first mammogram, and they're having issues that are being addressed, and unfortunately it's already found to be breast cancer in some cases. So we are seeing it at all ages, unfortunately.
There is some good news. The mortality rate in those diagnosed with breast cancer has been dropping recently. Can you share about that?
Yeah, yes. So yes, the incident rate has increased, but the mortality rate thankfully has decreased by about 42% since 1989. So thankfully we are seeing that number decrease as far as the cases that unfortunately lead to death from breast cancer or related issues. I think that's has a lot to do with increased screening, awareness, proper screening at the right ages, not stopping screening after a certain age, unless indicated, of course, research, extra funds. I think that is all helping to catch breast cancer earlier, which of course leads to better outcomes.
I want to mention when you were saying about there is not a cutoff. Is there a age cutoff for screenings, or is there not?
Well, you're going to hear some different things.
Okay.
Technically, the standards typically indicate to go as long as a woman is in good health, and usually they say with approximately 10 years or more left of life, and that kind of boils down to the woman's health and other comorbidities. But there's absolutely nothing wrong with continuing mammograms every year, and at the very least, keeping a very close eye on your breast health and getting that addressed if for some reason you have stopped mammograms at a later age.
And tell us about the importance of catching breast cancer early.
It is very important for many reasons, just in that hopefully it's caught as soon as possible, making it more likely to be a smaller size, an earlier stage, and that all typically relates to a greater survivability rate. The 5-year survivor rate for women with breast cancer caught within the breast tissue only is 99%. If it is beyond the breast tissue and is into some of the surrounding lymph nodes, it's around 86%, but that does unfortunately drop by quite a bit to around 31% if it has grown and went on to other organs within the body. So catching it early is key. That's really why we promote mammograms so much, because that's all we can do. There are things that can be done to reduce risk, but all we can do is just watch out for changes and have those yearly scans and just kind of follow up on anything abnormal to hopefully catch things as soon as possible, leading to better statistics, better overall health, and hopefully even less involved treatment.
Then, looking at the data, with out of the 100 people who get a screening, and that most are normal, but when it's not, that's when you step in. Can you just give us a little more detail on if I do have a problem? That I did see Casey come in after my mammogram and there was something abnormal.
Yeah.
can we go into a little more detail
Absolutely,
on
yeah.
what exactly happens next?
So the first step would be during the mammogram, the mammography technician is going to notify the radiologist of the findings, and they will review everything that comes up in those pictures. And with that, they'll typically ask for further imaging, which thankfully we can, during business hours, we can perform same day. So follow up as far as more mammography images, follow up as far as breast ultrasound if there is a spot that they want to get a better view of, and then based on that follow up, it gets followed up directly with the radiologist again, same day within that hour or two time frame typically, where they are then reviewing the further images and then deciding if they need to have the consultation with me to get them set up with one of the providers as far as general surgeons to have a discussion about a breast biopsy, just to get an exact answer of this finding beyond what they can see on the imaging.
And through that, I'm sure you're also a counselor, because to hear that could be a possible cancer and people get nervous or psych yourself out, like, I'm not going back.
Yeah,
But
yeah,
do
absolutely.
you have to sometimes coach people?
Yeah. So when we talk, we always talk in private in my office. We offer to bring back any family members that they might have with them, but we want to be very frank with them about their results, especially because they need to know as soon as possible to have this follow-up and understand the importance of the follow-up. And then also so they get all the information and they're hearing it in person, where they can ask me questions that I can answer as much as possible before their appointment with the doctor, but so that way they are not just reading about it later in their results or trying to kind of ignore the results, which I understand that that's what we want to do sometimes when with health concerns, but to address things quickly and to get those appointments set up as soon as possible.
I was just thinking of now it's so much information with the internet, social media. Do you often get people that become their own doctors or their own providers and diagnose themselves?
Yeah.
So even though you see one thing on the test, that the patient might see something, or in their mind see something completely different.
Yes,
So.
this is true. And sometimes they are less worried about it than we are, and sometimes they're more worried about it. So I think that's one of the biggest reasons why it's important for them to have that conversation, get the information, and leave with an appointment set up to meet with the next step. So one of the surgeons to discuss the next steps, because sometimes they will try to downplay things, understandably out of fear, but out of worry of pursuing this and proceeding with the testing, only to find out what could be an inevitable result with or without the testing. And so it's also important for women that might have further concerns beyond what is clinically warranted to still have those discussions. Typically it would be back with their referring provider, but basically to make sure that what they are concerned about is addressed, especially if they're at a higher risk.
Mm-hmm. Another thing is you mentioned if a person has a family member there. That's very important as well. As I know when I'd gone with my mom, and when she was diagnosed, then she said she remembers nothing.
That unfortunately is very common too. The stressful, extremely overwhelming information. A lot of times you're leaving appointments without anything printed off or without any handouts where you know what's going on, especially before we know what's going on, before
Right.
there is a diagnosis. But even those stressful conversations only can cause women to anyone to kind of not absorb everything that's being said, not understand the importance of what's being said. So having a support person with them, if that's the case, if they have someone, is good. Basically a second set of ears and
Right.
someone that understands the stress of what they're going through as well.
Because I had a huge notebook and I'm just writing things down, and she said, "What did they say? What stage? Whatever." And so I'm like, "It's right here. You didn't hear that?"
Yeah,
She's like,
yeah.
"No, I didn't." So that's why I know having a support system or just another set of ears often is very helpful.
Absolutely.
When should most women be screened for breast cancer? Or-
Tip-
Yeah.
Yeah, typically annual mammograms should start at the age of 40, and that was reduced. It used to be at the age of 50 or 55, but they have really, most standards have encouraged women to start at the age of 40, getting a yearly mammogram. Some data, some standards, and some providers might say every other year or at a different age, but in general, starting at the age of 40, unless there is additional family history. So women with multiple family members with breast cancer might need to start earlier as per their provider indicates. And women with, if they have had some other, health history, other concerning changes to their breast tissue, or if they've just had, biopsies or issues before that are unrelated, but they might need to follow up on just based on what their doctor says. And then women that know that they might be at a higher risk based on genetic testing that they may have pursued based off of family history. That's important to understand that as well. Or if they've had a family member diagnosed at a younger age. Typically they'll say to start mammograms at 40 or 10 years sooner than the youngest patient, the youngest family member that was diagnosed with breast cancer. So if they had a family member, especially diagnosed less than 50, that's a good sign for them to start maybe in their 30s.
So that's a good time that when you're having family gatherings, or to actually be very honest. And sometimes it's not the easiest conversation to say, because often people say, well, I had no idea that another person in our family had been diagnosed, or to be prepared, or what we should do. So
that's very true. It's a good idea to have those discussions to kind of promote screenings and to promote kind of the watching their health as much as possible, but also to have those conversations about family history to understand their risk and their true history that they might have. A lot of families maybe don't discuss things as in depth. That seems to be more common with some of the older generations. When I'm asking about their family history, when we're talking about things, they might say that their parents or their grandparents never talked about things like that. That's a pretty common thing that we hear. So it's important to understand the family history.
We've been over the summer, as people are having family reunions, we realized a thing that people were saying, we didn't know about this health matter or whatever. So we've been going to different family reunions per request and taking information about breast cancer or things from the American Cancer Society. Just because what a lot of people were saying, we only knew, we only got together for a funeral. We didn't get together for happy times. So if we're trying to stop the spread of different diseases, or just making sure people are knowledgeable about it. And so that's been a really good opener to say, hey, did you check up, aside from all the great food, did you check the different information that's available so that the entire family's learning? So
that's a great idea. I'm often pestering many family members about following up on their current orders or just their general screenings to make sure that they're checking things out. Yeah.
We'll definitely have to get together because it's actually, I was shocked at the response that we received. And people are like, wait, can you? We did it one place, and then other people were like, hey, can you come and set up a table so our family can learn?
That's great, yeah.
So
that's a good idea.
So what is involved in getting a mammogram?
So a mammogram, the actual picture taking process is a few minutes per side, but the overall process is about 20 minutes, sometimes longer. But essentially you're in the main waiting room, brought back to a private waiting room where you change your top and any bra that you might have on. They do recommend no deodorant or lotion or perfume on that area, just in case it might interfere with the images. You get one of those soft, warm pink robes that you mentioned.
Very nice.
Everyone wants to take those home, and I get that. And you're kind of left in this private waiting room until you're brought back to your private exam room. And then the mammography tech will take care of you there, and the compression applies some pressure. Typically it's not painful, but for some women it is a little bit more painful if they're prone to more tender breast. But that process lasts a few minutes per side, and many images are being taken at that time. Then the tech will go and review things with the radiologist, who will give the okay or encourage a follow-up or set that up same day if needed.
Okay. What are some things people can do to reduce the risk of getting breast cancer?
Yeah, it's unfortunately that baseline risk exists of about 13%, but there are things that women can do, everyone can do, as far as ideal healthiness. So working on their weight, being physically active, limiting or avoiding alcohol, cigarette smoking, understanding their family history, understanding their personal risk, keeping an eye on their breast health and watching out for any changes, so that way they can be followed up on as soon as possible.
Okay. And what kinds of programs does Reid offer for breast cancer patients, and how would someone schedule
Yeah, absolutely. So
a mammogram or a check?
Yes. Two different ways as far as getting something scheduled. So if they're just due for their regular screening mammogram, with or without their doctor's order, they can do a self-referral and call central scheduling at our number. They can also schedule via MyChart, and that makes it really convenient to pick a day and time that works best for them. And maybe if they're thinking about it late at night, getting it done while they're thinking about it, while they're with their family members, versus calling during business hours. That's the standard for screening mammograms. Now, if something diagnostic is needed, so if there is an actual issue that is being looked into as far as nipple changes, nipple discharge, tissue change to the skin, a lump, of course, any breast pain, those types of things need a sooner follow-up than just a once-a-year screening. So anything found like that should be immediately brought to your provider's attention, so they can order that diagnostic imaging to see exactly what's going on and what might need done with it.
Great. We want to thank you so much for joining us today on Let's Talk Together, and thank you so much, Casey, for joining us.
Thank you.
And thank you for joining us on Let's Talk Together.
Let's shine by seeing the best in all of us, and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.